Gastroesophageal reflux happens because of too much relaxed muscle between the esophagus, or so-called gullet, and the stomach. As a consequence, the food the baby has taken, milk, feed products, will get mixed with acid from the stomach, then will go up in the gullet and esophagus. It will cause pain, discomfort, the baby will be screaming. Gastroesophageal reflux is more prevalent, is more common in babies who have other problems. For example, with those with cow's milk protein allergy, cerebral palsy, those babies who have problems with the lower end of the gullet. Gastroesophageal reflux happens in 1 in 2 babies, and sometimes it becomes as a disease, leading to poor weight gain, extreme vomiting, and poor growth. We know that the baby has got gastroesophageal reflux. Going back, looking at the baby behavior, particularly after feeds, when the baby regurgitates the milk they have taken, the milk may smell acidic. But on the other hand, we know that in the same age, baby may present with signs of colics or milk allergies. But the behavior of the baby with colic is completely different, because those will draw up legs, they scream and stop, whereas gastroesophageal reflux is more continuous. Those babies who vomit, who regurgitate, are more likely to be suffering gastroesophageal reflux other than colics. Gastroesophageal reflux is caused by relaxation of the muscle between the gullet, also called the esophagus, and the stomach. And we know that this is very common in babies because they are very young. With age, this muscle will become stronger, and there should be no milk going from the stomach into the gullet. As a consequence, we have to think about strategies to put in place to make sure that what they eat is more thickened. On the other hand, make sure that we play with the position of the baby. Upright position would decrease the chance of the milk going from the stomach to the gullet. The diagnosis of gastroesophageal reflux is straightforward for pediatricians. It's based on pattern recognition, on good history taking from the information given by parents about the baby behavior around feeds and after feeds. The baby will be regurgitating, will be vomiting with acidic smell, and babies will be screaming in pain after feeds. So based on that, we can make a diagnosis, but in some cases we end up doing a pH study, which involves putting a probe in the gullet and measuring the pH, the degree of acidity in the gullet, to demonstrate that the acid has gone from the stomach into the gullet. In very rare cases, in some centers they do endoscopy, in other centers they do barium swallow studies. But these are very unusual tests, as the majority of babies with gastroesophageal reflux are recognized on clinical grounds. Majority of babies with gastroesophageal reflux do not need treatment. The management of the condition is mainly making sure that we minimize the chance of the milk going from the stomach into the gullet, and that will include positioning the baby, make sure the baby is upright, obviously on the back, because that's safer. The other step of management without medication would be to make sure that the milk is thickened. That again will decrease the chance of milk going from the stomach to the gullet, as it is less liquid. In some babies, we recommend that on top of positioning, thickening, the baby get some special amount of milk reduced. So the volume they are getting every, for example, 3 hours is reduced to 2 hourly, which means that the volume being low, the content in the stomach is lower than what the stomach can hold. As a consequence, the milk will not go back into the stomach. In rare cases, then we need to give some medication, and medication given for gastroesophageal reflux, we start with the simple one, Gaviscon, which the mainstay is to improve the lining of the gullet and the stomach. When this does not work, then we have to think about giving medication to reduce acidity in the stomach. And in those cases, we give ranitidine, and in some situations, we give omeprazole. This tends to work because they're decreasing the acidity. It means that even if you had some reflux, the amount of harm, particularly of pain causing screaming, is reduced.